Hello everyone. Today we are going to discuss about the Pap smear, or that is also known as the Pap test. This Pap test is usually or commonly used to test a type of cancer that is the most common type of cancer in women. Most common type of cancer in women, that is the cervical cancer. So Pap smear is the test that is used to detect the most common type of cancer in women, that is cervical cancer. In this, what do we do? See, if this is the anatomy of the female reproductive system, these are the fallopian tubes, this is the uterus, this is the vagina, then this, the mouth of the uterus, there is a part that is known as cervix. This part is known as cervix, that is the mouth of the uterus or the topmost portion of the vaginal canal. The cancer of this part is the most common cancer in women, and the second most common cancer in women is breast cancer. So Pap smear is used to detect the cancer of cervix. We see the abnormalities present in the cells of cervix. In cells of cervix. In Pap smear, there is a collection of cells from the cervix, that is the lower narrow end of the uterus and top of the vaginal canal. And Pap smear is used to detect the early stage of cancer. For example, even if the cancer is not fully developed, that is the precancerous stage, then also we can detect it using this test. The Pap smear can also be used to detect the precancerous stage of cervix. So why do we need to do this test? First of all, this is the most common screening test of cervical cancer. This is the most common screening test of cervical cancer. This is not the diagnostic or the confirmatory test for cervical cancer. The confirmatory test will be biopsy or the HPV test. What is HPV? HPV is human papilloma virus. This is the virus that is the most common cause of cervical cancer. So these are the confirmatory tests. Biopsy is the main confirmatory test for cervical cancer. But if you want to do the screening of cervical cancer at an early stage, then Pap smear can be used. And this test is generally, we prefer doing it in women whose age is between 30 years to 65 years. Or more precisely, if we want to say, then we can also start it at 21 years of age. Means the reproductive age group of women, or the reproductively or sexually active age group of women. In this age group, we need to do the Pap smear. Now the question arises that how often it should be done. So in women from age 21 to 65 years, it must be done in every 3 years. But if you are doing Pap along with HPV test, then the duration can vary up to 5 years. So in every 5 years, this test has to be repeated. So till now what we have discussed is Pap smear, that is also known as the Pap test. This is the most common screening test used for cancer of cervix, and cancer of cervix is the most common cancer in women. The second most common cancer is breast cancer. So what do we do in Pap smear? We take the cells from the cervix and we see their abnormality, whether they are in cancerous stage or they can also be in precancerous stage, that is the early stage. So using Pap smear, you can also detect the precancerous stage in women. Then what is the age group? It is from 21 years to 65 years. And how often it has to be done? In every 3 years it has to be repeated. But if you are doing HPV test along with PAP, then in every 5 years you have to repeat the test. Now the question arises that how is it done? How is it done? How is the PAP test or the PAP smear test is done? So first of all, for the PAP smear test, we have to use a kit. This is the kit that is used for the PAP smear. See, you can see here it has a cyto brush. It is written here endocervical brush PAP smear test. So this is the kit that we use. In this kit, it looks like this. We have few things in here. One cotton swab stick, one spatula, then this is a brush, and here is a slide. I'll open it and show it to you after we proceed with the procedure. So first of all, let us see that how it is done. First of all, in every or in any procedure, what you have to do is explain the procedure to the patient. So here also we will first of all explain the procedure to the patient, that what are we going to do, why are we going to do, and what is the need for it for the patient, why is it important to do. Then after this we have to provide the position to the patient. What is the position given in this procedure? It is lithotomy position. The position given is lithotomy position. This procedure is generally carried out in gynae or OBS, OPD or IPD also you can carry it out. So the position given is lithotomy position. And whenever you are exposing any women or any person, then what you have to take care of is you have to maintain the privacy of the patient. Whenever you are doing any such kind of procedure where the privacy can be hindered, we have to provide the privacy to the patient using the screens or using a separate room for that. And if a male is performing the procedure, then you have to take a female attendant with you. Then after this, once the patient is in lithotomy position, see, this is a non-painful procedure. There is no as such pain in this procedure, so we don't need to give any kind of analgesic in it. But if after the procedure the patient complains of any kind of pain, then you can always give injection diclo after doctor's orders. And if there is any kind of excessive bleeding, then injection Trenexa or tranexamic acid can be given, 1 gram. This is diclo is 75 mg. So these two injections can be given to the patient always to manage any kind of severity or any kind of pain or bleeding. So after you have given the position to the patient, we will maintain the privacy of the patient, and then we will insert our first instrument, that is the speculum. Then this speculum is inserted, that is the Sims speculum, into the vaginal canal. So here, if this is your vaginal canal, then here the Sims speculum is inserted to see the canal properly, because at the end of the canal, at the topmost portion of the canal, there you will visualize the cervix from where you have to take the sample. So from here the speculum is inserted. Then our second instrument will be the AV retractor. Then you have to take the AV retractor to retract the anterior vaginal wall. Then you have to retract the anterior vaginal wall, and once you retract the anterior vaginal wall, you will see the external os of the cervix. The external os will be visible here once you retract the anterior vaginal wall. Then what you have to do? Then you have to take your kit. You always have to keep an assistant with you because this is a sterile procedure, so you will be wearing sterile gloves. You have to ask the assistant to open this kit for you. Then once you open the kit, since this is also a sterile kit, here I am not wearing the gloves, but whenever you are performing the procedure, you have to perform it in proper aseptic technique. You have to take this kit out like this. Then you will see these few things here. First, this is the cotton swab. This is the cotton swab. This is used to clean the, so you can see it here. This is the cotton swab. This is used to clean the external os of the cervix. So since this is the external os, first of all, we will clean the external os of the cervix using this cotton swab stick with NS, with normal saline. No any kind of betadine should be used here, because this may also affect the findings of your test. So first of all, you will clean the os of the cervix with this swab stick. Then you will discard the swab stick. Then you will take your next thing, that is this spatula. See, you can see here, this is your Ayer's spatula. You can see the shape of this spatula. This is known as the Ayer's spatula. From here, you will rub it along the cervix of the os of the cervix. You don't have to go inside the cervix or inside the uterus for that, for your procedure. You just need to rub it along the os of the cervix. Then once you rub it along the os of the cervix, you will get the tissues here on this tip of the Ayer's spatula. Then this tip of the cervix, the tip of the Ayer's spatula, this is the slide. See, this is the slide that you get in this kit, and you have to rub your sample here, rub your tissues here over this slide like this. Okay, whatever tissues you get, you have to rub it here on this slide. And then after this, we have the last thing, that is this soft brush. You can see here, this is the soft brush. This is the brush that is used on the cervical os to take the tissues of the cervical os. Then after you take the tissues of the cervical os with this brush, you again have to put this tissue on your slide, and immediately you have to keep this slide labeled, and immediately once you take all these samples with your brush and the spatula, you have to shift this slide into the Koplik jar. So now what is Koplik jar? This is a kind of jar which is filled with a solution, that is preferably formalin, and in this jar there are segments. It is commonly divided into 5 segments, and each segment you can put your one slide here. So in one Koplik jar you can put up to 5 slides. So once you take the sample, immediately before air drying it, you have to shift this slide into your Koplik jar, and you have to send it for microbiology for studying the samples or the tissues that you have gathered here. So hope this was you have understood the procedure. This is the slide which you can use, and this is the brush. This is the brush, the soft brush that you have to rub it along the os of the cervix to take your tissues, the samples. And then this is the Ayer's spatula. This also has to be used. And then this is the cotton tipped applicator or the swab stick that you can use to clean the os of the cervix. So once the procedure is done, you have to clean the cervix of the patient, because if there can be any kind of bleeding or something like that, you can use a gauze piece always to clean the os of the cervix and make the patient stable. Provide supine position, tell her to lie down and rest for a while, and then she can go to her home, because this is just a so after this the patient can go to her home, because this is just a OPD procedure. You don't need to admit the patient for this kind of procedure. So hope this was clear, and if any doubts are there, then they are always welcomed. Thank you.